Great. Thanks, Ellen. Afternoon all, and a very warm welcome to the Mental Health Engagement and Recovery webinar, Engaged in Recovery. I know most of you will be on your lunch, so we plan to stick to time. So welcome all. My name is Una Toomey, and I'm the strategy lead for Mental Health Engagement and Recovery. I'll be joined by the team shortly throughout the webinar. But first, I'd like to introduce Brian Higgins, who's the Assistant National Director in Adult Mental Health, to open the webinar. Thanks, Brian.
That's grand. Thank you very much, Una. And good afternoon, everyone. A very warm welcome to our Mental Health Engagement and Recovery webinar. So we're really happy to have you join us today as we come together to reflect on the progress that we've made across 2025 and also to look at the exciting work that's ahead for 2026. Today's webinar is an opportunity to share some of the work and acknowledge the contributions of so many people, including those of you who are on the webinar who've been involved in advancing mental health engagement and recovery, both across the HSE regional and national services, and of course through our partner agencies. We also want to recognise our international involvement with the IPS networks, with IMROC and with the World Health Organization. Your commitment and collaboration have been really instrumental in shaping meaningful change throughout the year. So throughout today's session, we're going to hear from the Mental Health Engagement and Recovery team. We're going to hear from our partners, and we're going to hear of some of our core workstream updates, which include an update on the lived experience research and the first HSE lived experience guidance document. We're also going to hear how this year we advanced the MHER Child and Youth Mental Health Service workstream, which is a critical step in ensuring that young people and their families are not only supported but empowered by prioritising early engagement. Today we're going to hear from the National Children's Hospital on their experience of engagement. And we'll also acknowledge the significant progress made in recovery education. We're also going to hear about insights from our National Lived Experience panel in a panel discussion later on. So together, these contributions reflect the shared vision of creating inclusive, recovery-oriented mental health services that value lived experience as a cornerstone of service delivery and policy design and implementation. I want to take the opportunity to thank you for being here, for informing us, for educating us, for challenging us, and for your ongoing support of our work. I hope that you find today an engaging and inspiring session as we continue to work towards transformative recovery-oriented mental health services right across Ireland. And now I'll hand back to Una for some of the more interesting stuff.
Thanks, Brian. Thank you for the warm welcome, and thank you again for your leadership and your commitment to mental health engagement and recovery. I suppose that's helped us drive the progress that we've achieved this year in 2025, and we look to the opportunities for mental health engagement and recovery in 2026. So as we are doing a lunchtime webinar, we're limited on time, so I'm sharing here our email address, which is mhengage@hse.ie. So please, if you have any questions or comments, please email us. Now I'm going to introduce our first speaker, who is Dr. Anya O'Donovan, who is a senior lecturer in mental health in UCC, who we partnered with to undertake a study on lived experience. And Anya's going to give you an overview now. Thanks, Anya.
Thanks very much, Una, and thank you for the invite to attend. So yeah, I suppose just to start off, that we were commissioned by MHER to conduct a piece of work. It was led up by myself and Ryan Goulding, who couldn't be here today, but I know that there are some other people involved, so it really was a very big piece of work and a collaborative piece of work. So we undertook two desk-based research projects, and the first one was a conceptual analysis of the term lived experience, and it's something that hasn't been done before, and we used a specific kind of tool to guide us on that. The second piece then was a scoping literature review. Again, we followed Joanna Briggs Institute for that, and we were looking for that part about how lived experience is applied within healthcare services, within peer support work and within family peer support work. So the first study was very broad, and we were narrowing it down for the second one. Move on the slide, thanks. As you can imagine, the report, I think, is like nearly 200 pages long, so trying to summarize is very, very difficult, and I'm sure there's nothing here that will surprise you. I suppose between the two, the concept analysis and the scoping review, what was really coming out very strong was the notion of power. And I suppose interrelated with that would be knowledge. So who owns knowledge? Where does knowledge come from? What type of knowledge is valued over others? We within the concept analysis, the whole purpose of it was to try and understand the meaning of it. We found that the meaning was quite diverse amongst the literature. But basically, what we came down to is it's very much around subjective understanding, and there's an interplay between kind of the interpretations that people make on the contextual factors in their mental health journey. Really, I suppose what was coming down to essentially was valuing diverse and nuanced perspectives and not just the singular viewpoint, and kind of challenging the more traditional biomedical model to really develop that understanding of what mental health is from various perspectives and various sources of knowledge. So that was largely kind of around the concept analysis. In relation to the scoping review, then there was quite a bit came out, particularly with peer support and family peer support workers, around their, I suppose, safeguarding the integrity of their profession, and protecting them, their protecting their role rather than them per se, protecting the role within the health services. And I suppose there was a lot came out about topics like othering, and disrespect, and not, again, coming back to not valuing the knowledge that was there. And I suppose what was brought to the table by peer support and family peer support workers that was unique was really around that authenticity piece, which was deemed as very, very important. So I suppose just the last couple of lines there are really just a couple. We had a lot of recommendations to Una, and I'm sure we can, people can ask thereafter with Una. But I suppose the big thing really was to recognise knowledge and value that knowledge, that there's a systemic change needed to avoid tokenism, and it's really about how we view knowledge and where it's created. Pay and support is an issue across the board, and again, if it's done tokenistically, if it's not a fully employed role, it is a big problem. And again, it comes back to, if you're not going to pay somebody, then where's their value, and what value are you offering them as to deliver their knowledge. And then the inclusive environment, I think, came out quite strong in a number of the papers, that often peer support and family peer support workers feel excluded within the workforce. So it is about integrating that a little bit more. So I suppose that it comes from the meso, macro, micro within the report. But yeah, so I will leave there. I think in 5 minutes.
Thanks, Onion. Some really interesting findings there. I suppose they align with our own strategy and also support the development of our lived experience guidance document. Now I'm going to introduce Jacopo Villani, who is a patient and service user lead in West Northwest region, along with Emer O'Neill, who is our lived experience panel member, to speak on the development of the lived experience guidance document. Thanks, Jacopo.
Thanks, Una. Yes, so my previous role would have been program manager with the Office of Mental Health Engagement and Recovery, and I was involved in developing this lived experience guidance document in collaboration with service user people with lived experience and other colleagues. And just to give you a little bit of background about this document, the Office of Mental Health Engagement and Recovery established a national lived experience panel in 2022 to embed lived experience perspective in sharing the vision, in the shared vision policy, which is the national Irish policy for mental health. And so the different, so the volunteer panel at the beginning had around 20 members, and they joined different committees of sharing the vision, and there were lots of successes and positive experiences. But along with these successes, also we noted we noticed some gaps. So, for example, some of the volunteers weren't sure about the roles, what was expected from them, and also there was a lack of readiness from some of the HSC staff to work in partnership with people with lived experience. And also there were requests from the regions to have some sort of standardized ways of working and processes in relation to working with volunteer and people with lived experience. So we decided that there was a need to standardize these processes, such as, for example, the recruitment of volunteers, onboarding of volunteers, trainings, and so we decided to create a small working group to develop this guidance. And so I led the working group between July 24 until May this year, 2025. And the aim of this guidance, which, by the way, is going to be finalized and published in Q1 next year. So it's in the final stages of finalization. So the aim of this guidance are to enhance the processes and procedures for the recruitment of volunteers, to enhance the skills, motivation, and recognition and well-being of the volunteers, but also to improve the readiness, the skills, and the capacity of HSC staff to be able to work in partnership with people with lived experience. So to create the skills for HSC staff and healthcare workers to work in partnership with volunteers, and then to ensure that there is a sort of infrastructure, a scaffolding to support volunteers and HSC staff. And so these are some of the contents of the volunteer guidance. So there is a definition of lived experience. There is a standardized process for the recruitment of volunteers, but also there is a definition about the roles and responsibility of volunteers. So this guidance brings some clarity about what is expected from volunteers, what is expected from HSC staff, so that everyone is clear about what the roles are. Also, the content of the induction is part of the document. There is a section about matching the right volunteers to the right role. And also a section about preparing HSC staff to enable them to work with volunteers. So there are some steps that can be taken to improve the readiness of staff. The topic of capacity building is included. So there is a list of trainings available in the different recovery colleges around co-production and volunteer induction, so that volunteers joining the volunteer panel can access these trainings. And then also there is a section on feedback, evaluation, support and supervision. And also it's an important topic also is the fact that we need to recognize and reward volunteers working with the Office of Mental Health Engagement and Recovery. And then an important topic also is administration and finance. So and there is a link to the national policy around reimbursement. So yeah, so this is the guidance document. And also in the annexes there are different templates, for example, a template for the expression of interest, a template for the exit interview for people who want to leave the panel, and also other templates that will help anybody to start engagement with people with lived experience. So in a nutshell, this document can help any team or any professional working within the HSC to support them in their journey to work in collaboration with people with lived experience. So we hope that this guidance can be of support to anybody who wants to do mental health engagement, so that they can just pick up this guidance document, follow the steps outlined there, follow the support that is available there, and do mental health engagement in a positive, constructive way. So I would like to introduce Emer, who is a member of the lived experience panel. And Emer, would you like to please just share your own reflection about the lived experience guidance and its importance, since you were part of the co-production team that co-produced this guidance? Thank you.
Thank you, Jacopo. I've been on the lived experience panel for almost 2 years now. And the work has been incredibly meaningful for me. The last couple of years have been a difficult time for me, navigating postnatal depression and autism an ADHD diagnosis and experiencing severe burnout. So the timing of joining the panel probably wasn't perfect. But like many people with lived experience, even when we're struggling, we still want to help others to not go through what we have. And what made it possible for me to stay involved during a really difficult period for me was the understanding and the compassion that was shown to me by the workstream leads and those that I was working with directly. And Jacopo being one of those specifically who I really do believe went above and beyond in terms of, his support, and making me feel very welcome and enough, more than anything. I was never ever made to feel pressure or guilt, which is something that, can really kind of exacerbate, feelings when you are in crisis or struggling with mental health challenges. And I think that was something that we really flagged in terms of considering, keeping volunteers on the panel, and not feeling like they, had to, leave if they weren't being able to give 100%. And I think even for me, when I needed to step back for long periods of time, I was always welcomed back with open arms, no questions asked. And that sense of safety and belonging is something that many of us have not experienced before. And I do really believe that that shows the real commitment of, the engagement and recovery program as a whole, really. It speaks to its core values and, I think what everybody is really truly trying to embed. What I see in this national guidance document is that it finally creates a consistent approach for volunteers with lived experience on how they're recruited and trained and supported and supervised across the country, because that's obviously something that I went through 2 years ago. And I think right now, volunteers have had varied different experiences depending on where they're engaging. And it's clear, as Jacopo said, that, staff were asking for clearer guidance. And I think this document really does answer that need. It does set clear standards around induction and training and committee skills, confidence building, well-being supports, mentoring, debriefing, and all of which I can vouch for will really truly help our volunteers immensely. This document will work towards ensuring that we have volunteers who are prepared and feel valued, and that staff will also feel confident in partnering with us. So over time, I think, it's going to strengthen the role of lived experience in shaping policies and improving the services. And for me, being part of this process as a whole has been extremely empowering. I went from being ashamed of my own story, and experiences, to realizing that they had value. And the fact that our reflections on this piece were listened to and genuinely shaped the document shows that lived experience is not just being invited in, but it truly is being embedded within. So I just wanted to say thank you very much to all the team members for creating that safe space for us, for me, and for the rest of the panel members, and for producing a document that not only, for us, it's genuinely informed by us. It's not just for us. So it is a full circle moment and proof of the commitment to embedding lived experience throughout mental health engagement and recovery here in Ireland. So, Gurmila Magav.
Thank you, Emer. Thanks for sharing your experience, and thanks to yourself and Jacopo and the group for all your work on the guidance document. We hope that it'll be useful guidance for the rest of our colleagues as well. So thanks for that. Now we're going to share some of the work in terms of mental health engagement and recovery and child and youth. So this year we advanced the Child and Youth Mental Health and Engagement Action Plan, and we have theme 12 of that, which is person-centred care. In the interest of time, I won't go through all of this. I might just go on to the next slide. just providing an overview of the action plan. So on our action plan, we have 5 core themes, and that is prioritising standing up a child and youth engagement panel along with a parents panel, progressing with advocacy, engagement and a recovery framework as well. Last year, we engaged with Fruiga and we worked on an engagement piece in CH09, and there's lots of key learnings that we hope to build on. Next, I'm going to hand you over to Mike Healy, who's going to speak to their experience of engagement in the National Children's Hospital. Thanks, Mike.
Thanks, Una, and good afternoon, everyone. I suppose it's great to be here and to share an update on the work underway for the child and young person mental health services within the National Children's Hospital. And I think for us, this is a rare and really meaningful opportunity. We're building something new. It's not a redesign, I suppose, not a replacement, but a completely new specialist inpatient service for children and young people. And as part of the National Children's Hospital, we will be opening 20 new specialist inpatient beds for children and young people with moderate, severe and complex mental illness. And I suppose these beds strengthen the national pathway and give us dedicated space, capability and expertise that simply isn't available today. It's a real step forward for young people who need this level of co-located care. And throughout today's webinar, I suppose we've heard how lived experience, engagement and recovery are becoming more embedded across our mental health services. And I suppose for us in child and young person mental health, that direction feels, I suppose, both natural and necessary. And young people experience mental health services differently. Their developmental stages, their context, their supports change quickly. And when we listen properly, what they tell us shapes the work that in ways that we couldn't design from a desk. And I think us on the team haven't got our engagement and collaboration right just yet, and that's why our approach is grounded in a few straightforward values around transparency, inclusivity, co-production, rights-based practice and safety. And I suppose these are practical things and behaviours that we want to see reflected in how we work together. One of our early priorities has been the recruitment of our regional service engagement lead. And I think this role really anchors engagement as part of how we will operate now and into the future. It's not something that happens occasionally, but something that will be built into our planning, our design and our governance structures. It also connects to the national direction you've heard today, putting in structure, consistency and readiness behind that lived experience involvement. With this role coming in place, hopefully in early January, we're starting with a regional survey, which we've co-designed collaboratively with the National Mental Health Engagement and Recovery Office. And that will be followed then by focus groups, advisory panels and expanded engagement and recovery structures throughout all of our governance and operational forum. And I think overall our aim is simple. We want to understand what matters most to young people and families and make sure that informs the design of the new service. Ultimately, we want a safe, effective family-centred service and one that reflects the real needs and real experiences and not assumptions. Next slide, please. When we look at what's guiding us throughout the project and the programme that we're engaged in, 3 things give a good overview. I suppose our driving principles, what we're doing now and what success looks like. And being person-centred is where we start. And for us, that means a service designed around the needs of the child or young person and not just the constraints of the system. And I suppose we're specifically focused on building an integrated model. And I think young people mostly move between school, home, paediatrics, community teams and specialist services, much more than adult. And they need services that feels connected, coordinated and consistent across those spaces. Because our unit particularly sits within the National Children's Hospital campus and the wider building, we're also aligning with the hospital's digital transformation. So we're making sure that our workflows, our communication and information systems actually support care rather than complicate it. And success looks like very practical things like individualised care planning, strong multidisciplinary work, good quality oversight, good outcomes, and most importantly, a service where young people are visible at the centre. Early engagement, I suppose, matters to us as well, and it sets the tone for everything that follows. We know that late engagement creates redesigns, misunderstandings, and sometimes avoidable problems for us in our programme and project. When we involve young people early, we start shaping the decisions before the service user ever comes in the door. And I suppose that means we're not designing for a hypothetical patient. We're designing for young people who will actually come to the unit and use the services. Area engagement also supports us as a safety in that young people and families often, I think, notice the barriers or the risks, the practical issues long before they appear in any formal processes. So their feedback helps us get ahead of those challenges. And our first structure of action, I think, is that regional survey, which it is nearly ready to go. But that survey is just the start. And I think our intention is a long-term cycle of co-design, feedback and learning built into how we work. And I think just to focus on one of the aspects around that digital transformation is around that digital workflows and what that means on a day-to-day basis for us. And I think a useful principle for us has always been that capture it once and capture it well analogy or principle. And young people, they shouldn't have to repeat the same story multiple times. And when they share what matters to them, their words should follow them throughout their care journey. So that's being respectful to them, it's being consistent, and it's acting in a way that improves their care delivery. And I suppose that's why we're putting so much time into our digital workflows, aligning the information, coding data properly, and building a single source of truth that does support that care quality and safety. And engagement becomes part of the workflow and not an extra task. And I think, just to summarize, I think for us, I suppose this is the future of engagement for us as a service and a new service setting up, which is that steady, collaborative and built alongside and with young people and families. It's how we keep strengthening the safety and quality of the care we provide. And I suppose we're looking forward to 2026 when we'll do more work with the National Office and key stakeholders and partners. I have included our email address there. If there's any questions or queries, or if there's anything else following this, please get in touch with us in the email on the screen. And thanks so much for your time today.
Thanks, Mike. That's very encouraging how you're prioritising mental health engagement and recovery and putting service users and their families at the core of the service. Next, I'd like to introduce Fiona McKiernan, who is going to speak to recovery education. Thanks, Fiona.
Hi, how is everyone? Good afternoon and good to be here. I just want to check something. I'm getting a little bit of... So I'm here to speak around the completion of the recovery education review that was undertaken last year. And this is a combination of a huge effort across all areas, but it wasn't taken lightly. And as you know, over the last 12 years, recovery education community has developed and extended its reach across mental health and communities across the country. And recovery education services and colleges are prime examples of working to the principles of centrality of lived experience, co-production, organisational commitment, and supporting recovery-oriented practice and learning identified within the national framework for recovery. So I'm sorry, I've lost my slide here. There you go, thank you. So the aims of the review that MHER commissioned was to identify good examples of recovery education provision in the existing areas that they are, to identify the structures and processes and the need to embed within the mental health services and to inform the co-production of our national strategy. Thanks, Helen. The work that was undertaken by the reviewers involved a wide range of approaches, as you'll see from the literature review conducted, and with 240 participants through a mixed method approach through online surveys, one-to-one structured interviews, focus groups, and qualitative questionnaires. Through the process, then all of this was analysed and proposed recommendations were developed from the findings. The key overarching themes that were provided from the review were, as you can see here on the screen, the national structure and the organisational commitment, personal recovery and where it places in with recovery education, developing the evidence base and clarity around current data collection and processes that we have within MHER. Communication was extremely important, both internally and externally, as a theme that rose from the review. The visibility and promotion and identity of recovery education was seen as a really important thing, and the purpose of recovery education. So I won't go into all of those because they're in our report and are in the review. So it's well worth a read. But these themes have informed the recommended actions, which will be now we'll be looking at in our strategy in the development of that. So next slide, Ellen, please. So as I've said, through the review, we have the foundations of what we plan to do through our co-production mechanisms, involving all the relevant stakeholders throughout the process to ensure inclusivity and shared ownership. It's really important that strong governance and oversight will be a part of this, and we're in the process of establishing an executive steering group. And this group will guide the strategy's development and of course supported by a series of working groups tasked with delivering specific actions. And in the new year, we will be launching an expression of interest campaign for participation in these working groups. And all activities will follow a structured project management approach because we want to maintain that clarity and accountability for the work we're doing. So no surprise to you on who will be involved, and it will, as you see there from the list, that's just an example. But the scope will require a comprehensive collaboration across a broad range of groups with experts to co-create this actionable plan. The expertise will reflect lived experience, of course, recovery education, practice and knowledge, leadership and strategic alignment, and various knowledge expert contributors to aspects of the work. And you'll see here from the examples of the working groups that were derived from recommended actions, they've described a broad range. There's only a few of them, as I said. The rest of the list of recommended actions and where we're developing the working groups are in the overall review. So how to make this happen and what do we need? Again, the organisational commitment, which we've mentioned as one of our main principles in recovery orientated services, is crucial to this. Strong leadership and commitment is vital. Communication throughout all the processes of the strategy, that will enhance the trust. It will enhance the working together and the collaborative nature of what we were trying to achieve. The data and evidence will provide us with an ability to see the strategic direction and be able to respond to challenges along the way. So it will require an oversight and collation of all the data and evidence coming in to see are we progressing this. So capacity for ongoing multi-stakeholder engagement. We know from our previous experiences, the ask we have of people to contribute to such broad pieces of work and the time commitment, but it is that the capacity is really, really important in order for us to achieve on this. So when this has been achieved, and we hope that will be at the implementation piece, it will require the multi-level efforts and coordinated across a range of organisations. MHER and the national support will be there to provide the guidance and support with the implementation of this. Regional and area resources, of course, around which we've known from the review coming through that in order for successful delivery and embedding of recovery education into services, that is crucial. Also that inclusion, that recovery education is part of existing and future service plans. So we really look forward to progressing this with everyone in 2026. The review has provided the evidence through the feedback and examples of good practice from the broad range of stakeholders. And it is our aim to through the co-production of this strategy, that we can deliver on and progress recovery education within mental health services. And I want to just thank all the recovery coordinators, peer educators, recovery education staff, all working into recovery education, and our mental health services and partners for making this, for making the review so successful, and hopefully the strategy will be as successful going forward. So thank you, Una.
Thanks, Fiona, for the comprehensive overview and for the plan forward as well for recovery education. I'm now going to hand you over to Michael, who is going to chair a panel discussion. Thanks, Michael.
Thanks, Una, and everybody for all that information that's been shared. We're going to now just reflect with a few people on what we've talked about and other experiences with MHER this year. So we're going to have a panel discussion on that. And the first person.
Hi, can you hear me, guys? Hello?
Yes.
Can everyone hear me?
Yeah.
Yeah? Okay.
Yes.
Hello, my name is Risha Burke. I'm from Clonmel. I'm a former registered nurse. I'm a mother to a 3-year-old, and I'm a very active mental health advocate. Okay, guys, this is it. My experience has been empowering. I suppose the highlight was a few months ago, I attended the AI and the online mental health conference. I did not feel comfortable sometimes during the conference when people were talking about online and AI. There was a consultant from Canada was starting to talk about online counselling, and I started to get upset. And the minister, they were discussing it, and I felt I needed to speak up. I want to highlight the importance of the nurse, doctor, counsellor, MDT relationship. As I said, I am a registered nurse, so I have insight into how important the relationship is. So basically, I wanted to give it an insight. This is the insight of the nurse patient reality. Basically, it was December, believe it or not, guys, it was December 2012. I was very unwell. I was attending the day hospital in Clonmel from 9 to 6. I was suicidal. Every day I was going home, I was either going to jump off the bridge into the river, or when I was at night time, I was looking at the blinds about hanging myself. And I was a big risk, as I have attempted to end my own life in the past. I went in one day, and the nurse said, "Right, Rita, what's going on?" I burst into tears. I told her exactly what was going on. They got me to hospital. This nurse essentially saved my life, because I was at a huge risk of ending my own life if this nurse hadn't stepped in and knew that something was going on. So anyway, then the counsellor from Canada stepped in, and he said, "Look, Rita, I was talking to you at lunchtime." He goes, "And you were very, very unwell." I said, "Yes, I was." He goes, "Could you do online counselling now, Rita?" I said, "Oh yeah, yes, I could." So the minister, Mary Butler, and the consultant from Canada gave me the reassurance that for vulnerable, or for maybe people who are in hospital or out of hospital or unwell, that they will never lose the nurse, doctor, MDT relationship with the patient. And I do agree with AI and online counselling. As someone now who has made the recovery, I could, but I do want to highlight that if someone is only starting counselling, that they need to have a person one-to-one in a nice room, sitting down with a cup of tea. What the lived experience panel has done for me for the last 2 years is just phenomenal. It has given me huge insight into mental health that I didn't know about. I got to work with such amazing people from the HSE and from other service users. So that's my contribution today, guys.
Thank you so much, Rita, and thank you for sharing your personal story there. That's never easy, and we appreciate it. But it really highlights there the value of having people with lived experience inputting to these kind of initiatives and service improvement initiatives and so on. And for you, Rita, the volunteer guidance that we just heard spoke about, how important do you think that will be in supporting volunteers such as yourself?
I think it's essential, Michael. Number one, you'll know exactly what your role is. You'll have clarity in your role. You'll know what's expected of you. You'll know what to say, what not to say, what not to do, what to do. And I think overall, it'll make all the PPIs, or whatever you call us, lived experience, it'll make us more effective and empowering people going forward working with the HSE.
Thank you, Rita, and thank you for joining us this afternoon. I know you have to get back to work, so we really appreciate your time.
Okay, it's lovely to meet you all, and I wish you all a great Christmas and Happy New Year to you all. Okay, bye-bye.
Thanks, Rita. So next, I'm going to be joined by Sarah Hennessy, who is a General Manager with the Child and Youth Mental Health Office. You're very welcome, Sarah. And earlier, Sarah, we heard from Una and Mike talking about, the development of engagement structures within child and youth mental health services. As a senior manager in those services, how important is that, and how do you see it benefiting services? Is Sarah with us? Okay, we don't seem to have Sarah at the moment, as they say on live television. We'll try and get her back. It's like the toy show. It's a live show here. I'll move on to our next panel members, which are from our own team, Debbie and Murphy and Ellen Forkin, and they're part of the administration team for us. And transparency, accountability, outcome measurement, that's really important in the work we do. I might start with you, Debbie, in terms of you're heavily involved in capturing that kind of information. Just to describe to us some of the data that you're involved in capturing.
Yeah, so I'm responsible for collecting the data for recovery education and IPS. This comes into the office on a quarterly basis. For recovery education, the coordinators from the services and colleges send it in. You can see from the slide there, this is a sample of some of the data we've in. It's from 40% of the colleges and services for the first 3 quarters. There's a bit over 10,000 engagements so far this year. These are really important to people using the services and their family members. I know Fiona touched on the review. Some of the feedback we got from the review from one person was that recovery education saved their life. And it just shows the hard work from the coordinators, the peer educators, the recovery education facilitators and all the staff. It shows all the hard work that they put into it to help people on the recovery journey. Ellen, if you go to the next slide. Yeah. So this is just a sample from IPS. So we received the data from the employment specialist. This year we received 65% of the data. You can see there's 485 currently active on the service. 336 are currently in employment and receiving in-employment support. And a further 198 have exited the programme into employment, which means this year alone, 534 people have gained employment through IPS support. Back to you, Michael.
Thank you, Debbie, and that's a really incredible statistic. There are 534 people getting into employment this year that has been using our services. So, and that shows, how important it is that we continue to gather this information so that we're able to track, what our activity is delivering for us. Ellen, I might move on to you now if that's okay. And you're also involved in capturing some of that data. You might just talk about what you're involved with, please.
Yeah, so hi everybody. I'm responsible for collating the mental health engagement KPIs from our area leads. So the KPIs are included in our mental health engagement framework as a strategy to improve accountability and to measure our actions. In terms of figures this year to date, we have had over 427 engagement events. There's been over 4,814 attendees at those events. It's been found that families and supporters are the most engaged with the population, followed by the community populations. 55 service improvement recommendations have been brought to area management team and local leadership from engagement events held, and of those 55, 36 changes have been made due to the recommendations. There are plans in place to improve the KPI outcome measures for 2026, which is in progress to demonstrate the great work that's been done by the area leads on the ground. Then in terms of other data, I lead out on the communications for the MHER office in terms of social media and the Smart Survey account. This is really important to us to share information, promote events, resources and training, signposting to relevant services and information, sharing of any recruitment information to do with MHER, highlighting research and findings, obtaining feedback, and fundamentally to grow our community to promote a recovery-orientated service. Just as a highlight then, we established our LinkedIn profile in Q4 of last year, which is gaining momentum rapidly, which is great. We currently have over 1,260 followers on there, with over 760 new followers just this year so far. And we have a great reach with over 38,000 post impressions. And I've also left, and I can share again, our handles for Twitter, LinkedIn, and YouTube. We love to connect with you all. Thanks, Michael.
Thanks, Ellen, for sharing all that, and it's wonderful to hear about all that engagement work going on, and particularly those service improvement initiatives that have emerged out of engagement. And that's why the organizational commitment is so important, that the issues that are coming up in engagement, that we have a response to them, and it's wonderful that we're able to track that and see that that is working. And it's also good to see that our digital footprint is developing. Thank you both, Debbie and Ellen. I'm now joined by Una, who's been our excellent MC all afternoon. And
Michael, I have enabled Sarah, just if you want to go back to that slide, her mic and camera should have been enabled. If you want to go back to that slide, please. There we go.
Thank you, Una. Hi, Sarah. How are you? Can you hear us okay?
I can hear you now. Thanks, Michael.
Yeah, apologies for our IT hitch there. It's expect the unexpected on live media, I guess. So thanks for joining us, Sarah. And we heard a lot already this afternoon from both Mike and Una around some of the work we're trying to develop in the child and youth mental health service around engagement. But as a senior manager there, I mean, how important is that work, and what benefits do you see it as bringing?
Thanks, Michael. It's absolutely critical to the development of child and youth mental health services. So as Una touched on, we developed our Child and Youth Mental Health Action Plan this year in February, and we did a consultation with young people with the help of Spun Out, and also with parents through the National Parent Council, and we got a lot of feedback from staff, and there was a lot of themes coming up. I won't go through them all, but I suppose fundamental was to involve young people and families and staff in the design and delivery and evaluation of services, to build trust again in the services, because a lot of that had been broken, and to improve access and availability. So to have the right service in the right place at the right time for people, to have consistent and safe services. And so what we're trying to do with the help of yourselves as an office is to have engagement with young people and families and staff at a strategic level nationally, in terms of the overall vision and direction of child and youth mental health services at regional level, local level, and at an individual level. So to look at innovative ways of engaging young people through design sessions, digital interventions, through individual care planning, and other methods. And we're working with yourselves, and we're also working with key partner agencies who have expertise on this, such as Jigsaw, Spun Out, YAP, and many other youth organisations. So that's how we're trying to achieve this, Michael, and it's absolutely critical, because we know it improves outcomes and improves experience of services for young people and their families.
Thank you, Sarah, for that update, and we're delighted to be able to work with you and colleagues in the Child and Youth Mental Health Office. Una, I might just ask you in now, if that's okay, and thank you for your excellent work in emceeing this afternoon. And as we know, it's a time of transition in the HSE at the moment. So where the regions are being set up, there's a new role for the centre in access and integration, and that obviously poses a challenge for MHER, Una. But can you talk about maybe a little bit of how we're addressing that and starting to work with the regions?
Sure. So from our perspective, Michael, I would see the regional structures as an opportunity. So in terms of our office, we apply a population-based approach to our resourcing. And if you look at the new structures, that's going to allow us to work more closely with the regions. It's going to support better communication. It's going to foster better and stronger relationships. And I think we can be more responsive and have more informed decisions. And ultimately, that will lead to more cohesive approach and more effective resourcing across the 6 regions as well. So I suppose if we look into next year, we're planning to stand up a mental health engagement and recovery oversight group for each of the regions. Some of that work has started, and we've got really good engagement in Cork and Kerry, and a lot of work is progressing across each of the regions. So for us, I would see the new structures as being a really good opportunity.
Thank you, Una, for that. I suppose we're coming towards the end of our webinar now at the moment, and thanks to everyone for staying with us and for all the contributors. And as you can see, we got a snapshot there of different work going on across our programs. But we have, of course, 5 core programs, which you can see on the screen there. And I recently just checked, and they're up on 40 different work activities that we are involved in. So it's a very comprehensive engagement, we do across the services. And just to highlight a couple of other things. In peer support this year, for example, we introduced for the first time the role of senior peer support workers. We have currently recruited 3 of those, and we're putting in one in every region. We've also started recruiting additional entry-level peer support workers and expanding our family peer support workers cohort. This year also, we're very close to finalising the family peer support worker toolkit, which will greatly enhance the work and the service readiness for engaging with family peer support. Just to talk also a little bit about IPS. We had a comprehensive training program for our IPS specialist this year. We started a fidelity review process, and we had a strategic engagement with other departments related to employment. Also in sharing division, we're continuing to work with 11 of the sharing division recommendations, which is over 10% of the entire recommendations. So it's a really shows the importance of lived experience led involvement at all levels of the service, and including policy development. We also are represented on the HSE implementation group and on the National Implementation and Monitoring Committee. And I suppose we can move on to the next slide there, Ellen, thank you. All that work that I mentioned, that almost 40 different pieces of work we do, that's across the whole broad range of areas, from the Department of Health internationally, national HSE colleagues and departments, across the regions, working with NGOs, working with lived experience led groups, and many others. And you can see just a snapshot of them there on the screen. And that's really, I suppose, a very good example of how lived experience needs to be at the heart of recovery orientated services, driven by people with real lived experience. And I want to express my gratitude to all the people who were involved in that work, and particularly the lived experience volunteer group nationally. And we've heard from 2 members today, Emer and Rita, and that's really important work. And integrating and supporting lived experience in what we do is essential and vital. And this year, to help us with that, what we carried out a survey on well-being of lived experience practitioners that are working with us. And there's a number of recommendations have come out of that we will be progressing next year to make sure, along with the volunteer co-production policy, that our lived experience practitioners are properly supported. This year also, we did an international work. We were involved in the development of the World Health Organization roadmap to integrate lived experience into health systems. We had a National Lived Experience Day. Again, that's just a profile lived experience. And next year, we'll be talking to people in the new year about how we can build on next year's lived experience day, where we really will want to support and promote lived experience and what it contributes. Also, very exciting developments linked to the Youth Mental Health Service around Discovery College. We have gained funding for next year also to expand from our one Discovery College Youth Recovery College at the moment to other areas. So that's going to be a really exciting piece of work. You can move on the slide, Ellen. We're getting very close to the end, but I suppose to summarize, next year, we will be continuing to implement our mental health engagement and recovery strategy. We will be looking at new initiatives around IPS, around engagement, around recovery education. We heard about the recovery education strategy. And an important piece, as Una says, is how we will work with the regions as a support to them. And our strategy comes to an end next year anyway, but from the new year, we will be working on developing a new strategy. We will be reaching out to all of you to help us with that in a consultation process to make sure that MHER is best prepared, to do the work that we're commissioned to do and it is important to do. We are at the end of this webinar, so I just want to thank everybody who has been involved today in the preparation of it and who presented, and all of you who came along to listen. And widerly to thank everyone who supported the work of mental health engagement and recovery this year. My manager, Brian Higgins, the National Access and Integration Mental Health Team, my own team, all the MHER staff around the country, recovery coordinators, peer educators, recovery education facilitators, area leads for engagement, peer support workers, both service user and family, and all the volunteers who work, to support all that work, and all the wider HSE staff, because engagement and recovery is everyone's business. So it's really important to acknowledge the work that you have all done. And we look forward to working with you again next year. And just to close the webinar by wishing all of you, I suppose, very happy Christmas in whatever way you celebrate it. I hope it's a time of renewal, of refreshment, and above all of hope, because that's the message we want to give in engagement and recovery. That the hope that things can get better, that things will get better. And as we demonstrated here today, by us all working together under the values and principles of recovery and engagement, that can happen and be achieved. Thank you all for listening.
Thanks all.
Thanks, everyone.